Welcome to my webinar. I'm here for Meta Oakland, Marketing of E-Cigarettes Towards Adolescents, a research study in Oakland, and we're a partnership between California Adolescent Health Collaborative, a public health institute, and the Center of Tobacco Control Research and Education of University in California. We are Meta Oakland. I am Namie Peoples, project coordinator and co-researcher. And we also have Ayala Ferrier and Elizabeth Matute, co-researchers. We have Robert Lee, project manager, Allison Chopay, project director and primary investigator. And we have Pamela Ling, and our primary investigator from UCSF. Who's not here today and no longer on the team, we would like to shout out Zoe, Adora, and Daniel for their contributions. So more about me. Again, I'm Namie, and I'm a project coordinator on Meta Oakland, and I've been here for 2 years on the project, and I'm formerly a youth radio's youth journalist. I'm also currently in high school. I'm a high school senior at James Logan High School in Union City. So our research question is, what are youth perceptions and responses toward the electronic cigarettes marketing and messages that they encounter? So our research process involved community-based participatory research and geonarrative, which is a qualitative geographic information system-based narrative. And we also use photo voice, and it's when you see a photograph with a narrative and it's describing specific social impacts. And we basically did this research in downtown Oakland and other areas that included Hayward, Antioch, and Union City, and also Alameda. We focused on community market stores, looking at how e-cigarettes and other tobacco products are sold and advertised. This is Photo Voice. Photo Voice starts with a photograph taken in a community, focusing on a specific social aspect. The photograph is the source of the subject that impacts the narrator. This is the other half of Photo Voice, the narrative. The narrative describes the social impact within a photograph, and we use SHOWed as an acronym. The S stands for what do we see in the picture. The H stands for what's really happening in the picture. The O stands for how does this relate to our lives. The W stands for why does this problem exist. The E stands for how could we change or educate others and inspire change. The D stands for what can we do about this. Here are our results and conclusions. Our data collection consisted of over 50 photos of narratives, and our analysis discovered that we had over 18 common themes. Our findings are that how specific communities use tobacco and e-cigarettes, and also how communities are influenced by policies in education. Young people are aware of the trash and chemicals from tobacco products, but then again, they don't really know what's in it. And tobacco companies increase in influence and use specialized tactics, advertisement through social media and association of other vices like gambling, drinking, smoking, just targeting of little children and non-white communities. Yeah. So here is our photo on colors and flavors theme based on e-cigarettes liquid. So when you first look at this picture, you see multiple e-cigarette juices, and this is at a local pharmacy in youth frequency areas. And basically, you first are walking up to the register, all you see is highly organized what they call electronic cigarettes products, and all you can see is the colors, the flavors. You see cool ice, you see grape, you see cherry, you see berry, mango, guava, raindrop. Of colors. You just see a rainbow of colors. And as you see, they sell everything separately. There are the motors itself that The motors itself that basically run the e-cigarettes are 29 bucks by itself, and the tips and the pieces are sold separately for cheaper. But as you look at the bottom, you see that there are small pins that are already put together for you. So they have it all down packed and ready for you guys and new smokers to get addicted. Next is our inventory theme on e-cigarette liquid. So this picture is just very broadened with the colors and the flavors. There's over 200 flavors of chemical juices. And again, we don't know what's in these juices. There's flavors up the wall. And you can, what if people mix the colors or try to get a flavor from the berry and the cocoa, or, try to mix it? You're just mixing nicotines and they're not telling you that. So it's really dangerous just having all these products there on the counter. And it's, like I said, it's youth eye view. Like, as soon as they walk in with you, they're looking at these eye drop color flavor looking things. And again, people use these indoors that pollutes our air. So yeah. So next slide is on our marketing tactics, and we basically have to go into detail about the history on black labeling. And so basically, what is the impression you get from black labeling? And that is a dark feeling, a dangerous feeling, or an exclusive feeling, limited edition. And they first use this on whiskey, then they use it on Jim Beam whiskey, then they use it on beer, and then they use it on hemp juice, an energy drink, all the way up to Mountain Dew, where kids drink these. And it says crafted dark berry and specially made, deeper, darker, doer, give you that feeling that it's exclusive. So why would it be surprising that they use black labeling on e-cigarette juices? It's right there on the counter, for one. As soon as you walk into the store, all you see is this exclusive box of e-cigarette juices from Los Angeles, California. And as we circled, you see it says California, crafted and stemmed to perfection, made in kosher grade ingredients, premium e-cigarette liquids, and it also has special reserved and black labeling, again, as you see. So why, again, would they sit this right eye level to children when they walk into the stores? And it's just marketing. It's their marketing tactics that they use towards this all the time. It's them setting up ways to just reel us in. Our next slide is on advertising theme, and this is our packaging category. So if you look at the picture, you see a lot of products, and basically at the top row you see e-cigarette products. Then that's directly, it's expensive, one of the most expensive, I guess, smoking products in a pharmacy near our youth frequented areas. And if you see it, it says Mystique, and the flavor is dark ice and shadow cranberry or cool ice, and it's just really majestic names to try to get you to buy it. And it's just a whole rack of cheap tobacco. And the names that we circled here, one of them is Al Capone and Blackjack and Special Factory Made, all these tricky names to get you guys drawn in to the new tobacco. Our next picture is on a product placement theme, and the sub theme is kids eye level, and the fact that as soon as you walk in the store, all you see is a bunch of e-cigarette products. And if you notice, behind the counter you see tobacco products. In the back you see the Newports and the Milbros and stuff. But as you look down, you see there a variety of e-cigarettes, and they look like toys. and it's a see-through container. It's eye view. Kids see straight through them, and they would think they're toys, because I would think they're toys. And yeah, it's just, maybe they should have a type of souvenir leaving the store, and it's not even a toy, it's a smoking product. Our next theme is on our community theme, and this is in one of our youth frequented areas category. So as you look at the picture, you see a young person using a e-cigarette device, and we've been seeing these bigger e-cigarette devices, and as you see, it's like almost as big as his iPhone right there. And again, he's working at Six Flags as a concession stand worker, and maybe he's contaminating the food by mixing the nicotines and the juices that goes into those devices. But you never know, and it's something that they should ban from amusement parks, because it's, again, a youth frequented area. So our next photo is on our education theme, and it's expanding anti-tobacco awareness, basically. As you look at the photo, you see a young girl who's posted on Snapchat, and she's a freshman, and she's blowing out a lot of smoke. And if you didn't really know the difference of the smoking industry, you wouldn't know if it was e-cigarette or marijuana, but you would think it was vaping, about how much smoke is coming out of her mouth, but it's not. And it's not even cool, because again, the law is that 21 and over to be able to purchase anything that has to do with nicotine or tobacco. And again, their local stores are selling it to them. Again, they are the target of the product. So as we next photo, you will see there are our policy theme. And if you live in California, you know that the new law is you have to be over 21 to purchase tobacco products. And our picture shows you that everywhere, every store that we go to, there's a huge label saying that you have to be over 21 to purchase. And it's just reminding minors that they can't buy it, yet they're targeted, and it's for them, basically. The flavors, the colors, these new products, the healthy way or the techie way to smoke, it's all for them. But again, the store merchants have no problem selling it to them, because again, they're the pot. And this is really affecting us, because it's like, how do you guys tell us we can't smoke tobacco? Not only that, you guys don't tell us what's in tobacco, but now it's targeted towards us, and we can't buy it until we're 21. And they should just work on awareing the prevention of tobacco. So from our findings, we found that menthol cigarettes was the most prevalent flavor sold in the Oakland and Bay Area local market stores, pharmacies, and liquor stores. Not only that, we found that the flavors and the colors are clearly targeting youth and little kids, and this is a need for prevention education for those under 21. And there also is a need for more policy and tobacco regulations. Our funder is Tobacco Related Disease Research Program, and we would like to give a special thank you to our steering committee members, Molly Baldridge, Kimberly Vagadori, Rachel Main, Tamiko Johnson, and Paul Cummings, for all the hard work that they gave to our project. And we would also like to thank our partner organizations, California School-Based Health Alliance, California Youth Advocacy Network, and Alameda County's Public Health Department. We would like to thank you guys for tuning into our webinar, and thank you again. Please don't smoke. If you guys have any Q&As, please contact us. Our information is below. You can go to www.californiateenhealth.org.